Welcome back. Republicans have just over a week before their self-imposed deadline to pass the president's one big beautiful bill, as it's been dubbed. And senators are scrambling to resolve their differences on several key issues. One major sticking point right now is the proposed cuts to Medicaid, including debate over the provider tax, which helps states fund the Medicaid program. Now, some Senate Republicans are warning the cuts could be devastating to rural hospitals and the communities they serve. NBC News Capitol Hill correspondent Julie Tsirkin traveled to Missouri for a firsthand look at the potential consequences.
In this small town in rural Missouri, past miles of farmland, is where Sierra Matthews lives with her two young sons.
Gotta pace yourself better.
Before Missouri voted to expand Medicaid access in 2020, Sierra, who works in the public school system, had no health insurance, and she falls below the poverty line.
Medicaid kind of gave you almost like another chance at life.
Oh my God, yeah. I 100% have been a completely different person just from the diagnosis alone.
Sierra finally received the mental health treatment she says she desperately needed.
What do you think it would mean for her to lose access to that medication?
She just wouldn't be doing as good. I love her.
Republican lawmakers proposed changes to Medicaid as they attempt to cut federal spending and fund President Trump's agenda.
We're making some common sense reforms to Medicaid to eliminate waste, fraud, and abuse.
On the table, new work requirements for some adults and limiting a healthcare provider fee that states use to fund Medicaid, especially in rural areas.
I'm concerned about some of what the House has done on rural hospitals, essentially the hospital tax.
Dr. Rothermick is the chief of staff at the hospital in the town of Herman where Sierra lives. He says the proposal means billions in funding would be gone.
To suddenly change it without identifying a way to pick up those lost funds is going to leave a lot of patients, providers, facilities without appropriate funding to take care of the patients that need our care.
Is there any more fat to trim here?
I don't think there is.
Rothermick says they are already underwater. Just 3 doctors work at the hospital that cares for patients in 2 counties, where about 1 in 4 people rely on Medicaid. Those 3 doctors have to work overtime, and in some cases, multiple jobs to fill the void.
You wear many hats.
I do. I work with the health departments. I work with the EMS as their medical directors. And I even have a role in hospice that I work outside of this.
The resources are even fewer in southern Missouri.
We've lost 3 hospitals in the last 10 years in our region.
Karen White is the administrator for the only healthcare provider in a 3 to 4 hour radius. And Karen says nearly half the population her hospital services relies on Medicaid.
I think we will see loss of life. Maybe not immediate, but if chronic conditions go untreated for an extended period of time, it does result in lower quality of life, less people working.
President Trump says he wants to preserve Medicaid.
The Democrats are going to destroy Medicare, Medicaid, and Social Security. And we're going to keep them, but even make them stronger.
Missouri, like many other states which will be affected by this policy change, overwhelmingly elected Trump.
It does seem a little odd that the folks that elected them will be the ones that are impacted the most with these cuts.
Do you regret your vote?
In some of the decisions that have been made, yes.
And Julie Tsirkin joins me now. Julie, fantastic interviews. Thank you for bringing us that report. We really appreciate it. So let's talk about the very latest on Capitol Hill around this debate to address these concerns about rural hospitals.
Kristen, to be clear, there are several issues that are keeping Republicans from passing this bill, from the House from passing this bill. But rural hospitals and the impacts that the Medicaid changes could have on them is by far the thorniest issue. That's according to multiple Senate Republicans that I spoke to. Now, what they're doing to help alleviate the problem that they essentially created with these cuts that they say would be used then to fund President Trump's ambitious campaign agenda is to create a separate fund that would go directly to rural hospitals. One number that was floated around today was $15 billion. That falls far short of the hundreds of billions of dollars that experts predict these rural hospitals will lose over the next decade. I did ask Leader Thune, who's of course the top Republican in the Senate, as you know, about this yesterday. Here's what he had to tell me.
We are working on a solution for rural hospitals. And That's something that's been in the works now for several days in response to a number of concerns that our colleagues have mentioned about ensuring that the impact on rural hospitals be lessened, be mitigated, and I think we're making good headway on this issue.
Now, of course, this is such a huge issue for them. Senator Susan Collins, for example, who's also been working on this fund, said she wants to see something closer to $100 billion in order to get her vote on this bill. Thune just moments ago, Kristen, said he can't see a number that high happening because it will lead to the cost of the bill going up.
All right, Julie Tsirkin there on Capitol Hill, pressing everyone involved in this debate. We really appreciate it. Fantastic reporting, Julie.
We thank you for watching, and remember, stay updated on breaking news and top stories on the NBC News app or watch live on our YouTube channel.